What's going on, everybody? It's Dr. Sudicky here, and in today's video I wanted to add some commentary to two videos. The first video is one by Jeff Cavalier, also known as AthleanX, who puts out some really good fitness content on YouTube. He's probably one of the most popular YouTubers online right now. And also the commentary provided by Doucette, I hope I'm pronouncing his name right, who's a professional bodybuilder in Canada. He has a master's degree in kinesiology, and he also made some good practical points about the realities of sustainable fat loss and what's required if somebody really wants to stay lean all year round. So this isn't a call out video. I'm not a channel that makes those. I'm just adding some commentary to those two videos. And also, as a full-time Canadian family physician, putting that message and repackaging it into the clinical context. But to start, I wanted to talk about my own fitness career and how I agree with what they're saying about what it takes to stay lean all year round. So looking back to 2005, 2006, that's when I started working as a fitness model, obviously not full-time. I was a university student at the time. I was first published in Muscle and Fitness in 2006, and then every month or so, every couple of months, I'd have another photo shoot with a different magazine and things steamrolled. And there was a point where almost every month, every other month, I was getting a phone call from a magazine. Especially lucky being close to Toronto. Those days it was Maximum Fitness or Reps, where I would drive into Toronto and have another photo shoot. Now, the reality of being a fitness model is those who are ready are those who get the jobs. So I had to stay lean all year round. I was within 5 or 10 pounds of photo shoot weight from probably 2006 until 2014 when I finished my first year of medical school. And similar to the message provided by Greg in his video and Jeff in his, it took a lot of sacrifice and commitment, and that's just the reality of staying lean all year round. There isn't a magic diet. You don't have to cut out an entire macronutrient from your diet. You don't have to follow keto or one particular dietary approach. But it takes consistency. It takes focusing on some of the most obvious things in your diet, like avoiding that peanut butter in your protein shake in the morning, or the peanut butter at bedtime, or drinking less alcohol. But if you're motivated enough, it is possible. However, go into those goals realistic about what it takes to stay lean all year round. Also, to their point, I didn't do a lot of cardio as a fitness model, if any, for a lot of photo shoots. And as Greg was saying, my training didn't change. I still trained heavy. I always trained to maximize growth. And if I had a phone call or an email from a magazine saying, "Hey Aric, we have a photo shoot in 14 days. We want you to demonstrate a chest workout or a leg workout. Are you ready?" I'd say, yes, I'm around 5 to 10 pounds above photo shoot weight, no problem. My training wouldn't change. My diet would change. And I would take a step back, look at the easy things to change. For those of you who know me personally, I have my favorite bedtime snack with Greek yogurt and some whole grains and berries and peanut butter. It's easy to know what to change if you look at what the biggest offender is from a calorie perspective. So for example, looking at that meal. Doused in peanut butter every night. It's delicious. But from a fat loss perspective, just by removing the peanut butter on my evening snack, that's 150 calories, if not 200 if it's 1.5 heaping tablespoons. Or my morning protein shake, peanut butter again, that's another 150 calories. Now we're up to 350 calories gone from my diet. My lunch, if I'm having a big salad with some chicken and some grains on the side, but I douse it in olive oil, even just reducing the portion or even removing the olive oil and just focusing on vinegar for a week or two, there's another 150 calories or so. So you can see that by reducing your calories through food fairly quickly, without overly restricting yourself, you can find a 500 calorie a day deficit. Now, studies have shown that for initial weight loss, it is easier to focus on diet. And that's the point of Greg in his video. Can you lose weight by exercising incessantly initially? Yeah, you can, but it's difficult to sustain long term. Now, I've also said in other videos that science also does suggest that for sustained weight loss, people who maintain weight loss long term also tend to be regular exercisers, and it's probably that added calorie burn that you're getting. But for initial weight loss, also for myself as a fitness model, it was diet. It was simply reducing my calories through food. Now again, that's just what worked for me, but it does make sense and it's supported by the literature in terms of what works for initial weight loss. I didn't follow any particular extreme dietary approach. I didn't remove an entire macronutrient from my diet. I simply reduced my calories. However, it also helped by staying fairly lean all year round. So I only had a few pounds to lose to get ready for those photo shoots. It would be a lot harder if I was carrying 20 or 30 pounds of extra body fat to get ready for those shoots. Now, reflecting back, as a lifetime drug-free athlete, did I sacrifice some gains over that 10 years by staying so shredded lean all year round? Absolutely. I could have gained far more muscle over a 10-year period by allowing myself to have a little bit more body fat. Not a lot, and again, Greg makes those points in his videos. I'm talking the difference between being 6 to 7.5%, 8% all year round versus being in the low teens, but it does make a difference. Now, fast forwarding to family practice. So right now, I'm a cradle-to-grave family physician full-time here in Canada. And of course, weight loss questions come up all the time in clinic. And similar messages apply. So a lot of people will read a blog or a magazine article that claims that one specific type of workout is going to speed up your metabolism and cause rapid fat loss. It just simply isn't true. And it's also hard to make those extreme changes in the context of the busy, complex life of the patient sitting in front of you. For example, a lot of people are single parents with 2 jobs, with financial strains, and multiple children, and after-hours commitments. They can't afford a gym membership. They're exhausted at the end of the day, and they have goals of weight loss. If given the choice, sometimes you have to choose one: dietary change or exercising significantly more initially for weight loss. And often the solution is to take a step back and choose one. Of course, it's beneficial to do both long term, but from a weight loss perspective, it really is easier to reduce your calories through food initially, especially, back to Greg's video, if there are culprits. I shouldn't call them culprits because you don't want to fearmonger food, but if there are sources that are quite high in calories in the diet, for example, myself drizzling excess peanut butter on all of my snacks because it's delicious. Well, from a weight loss perspective, I probably have 200 to 300 calories a day from peanut butter some days. So if I wanted to lose weight, I'd probably have to reduce it or potentially cut it out depending on how significant my weight loss goals and how much I want to lose and how fast. The other important thing is the goal of weight loss itself. Sometimes people simply aren't ready to have a goal of being shredded lean and may need to focus on the habits initially and let the weight loss be the consequence or outcome of the habits. Now, do some people need to track their calories? Absolutely. And there's absolutely a role for calorie tracking. But if somebody is working long hours and stressed and compensating by binge eating on weekends and drinking a lot of alcohol every weekend, well, maybe the first step to weight loss goals is simply changing your weekly habits and then focusing on the nitty-gritty of your diet and maybe drinking less alcohol every weekend, getting better sleep, trying to avoid the restriction binge eating cycle back and forth, and finding a more enjoyable, sustainable way of eating, but still not feeling guilty to treat yourself. And then once you have the fundamentals down pat, then tracking your calories if you have to further reduce your body fat. And again, you may not have to perform cardio to do that. Is it beneficial? Absolutely. But the cardio isn't a must for initial weight loss. So taking a step back, the umbrella message of today's video is your habits should fit your goals. If you have goals of being a professional fitness model and getting paid by magazines all year round, your habits will have to fit those goals of staying lean all year round. And hopefully you can find a way to not feel overly restricted to sustain that for months or years on end. It's absolutely possible, but just know that there's a lot of hard work, especially on the nutrition side of things, to maintain that. The other important message is you don't have to excessively exercise to achieve initial weight loss. If your goal is initial weight loss and you're busy and you're unsure which to choose first, you may want to take a step back, reflect on your nutrition, track it if you need to see if there's anything that is an easy first thing to tweak to reduce your initial calories. It's beneficial to exercise, of course, long term, but it isn't absolutely necessary for initial weight loss. I hope you enjoyed today's video. If you liked it, hit the like button and be sure to subscribe so you get notified every time I post a new video.